thing we have is the approval of agenda. Is there any additions or corrections to the agenda?
Hearing none, I'll make a motion to approve the agenda.
Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Contrary, motion carried. Next, we have the approval of the minutes from last week.
Seeing no corrections, I thought the minutes read well. I'll make a motion to approve the minutes for the October 4th meeting. I'll second.
Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Contrary, motion carried. First thing we have on the agenda is to go into closed session for Iowa Code 21.5 C and 21.5 G. It's been moved and seconded. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Contrary? Oh, you want,
We
yes.
have to do.
Roll call. Yeah, I got a roll call, that's right.
Myers,
Yes.
Ruggles,
Yes.
Osman. Yes. Johnson.
Yes.
Shep.
Yes.
Okay, motion carries.
Or maybe not. They may hire some young go-getter. Here's them up.
He's moving on to a different category, but I don't think he's leaving.
No, he's not
No,
leaving
he's
town.
not leaving, he's gonna do it more online.
Yeah, it's an online newspaper.
We're coming up.
Okay, we need a motion to go out of closed session.
Second.
Then move in second. Any further discussion? If not, roll call.
Not to go out.
Huh?
Not to go out.
All those in favor, signify by saying aye.
Aye.
Contrary, motion carries.
Thank you very much.
Thanks, John.
Have a great day.
You know, I had more time to think about that. Sometimes just-
The joke I like to tell, one of my professional inspirations is now retired Assistant Attorney General Pete Grady, and he always used to say at conferences, he goes, put people in prison that you're scared of, not people that you're mad at. But you can't afford to do those. If we did, it'd probably take the budgets of Iowa State, Iowa, and you and I to do it. Okay, that's the perspective you have to have. So, thank you very much. Enjoy the day.
Thanks, John.
Thank you. Nope.
We are back up live.
We are live.
Thanks, Dalton,
Okay. Thanks, Dalton.
or Ben, whoever.
Whoever's doing it. Okay. Then we just came out of closed session. There was no decision made on anything. So we'll move on. First thing we have to do is discuss the approval of the proposal for the county health services assessment. Now Dean stepped out.
Becky's online.
Becky, you online? Becky?
Yes, yes. Can you hear me? I guess I wasn't prepared to say anything. If anyone had questions, I know we've got John Stevens online too.
He's back in the room.
You want John to say a few words?
Yeah, are you on?
Good morning. Yes, I am.
Okay, so we have John Stevens from the Stevens Group, yeah, and a couple others as well, I'm sure, John. And
Yes,
the
I
board-
have Richard Kellogg from my team joining us.
so it was a request by the board to have a little interview with you and your group, and we'll just let you go ahead. You know, the RFP was to do to submit a proposal for review of total Carroll County Health Services. So Becky Vanami is also on the Zoom, our Board of Health Chairman. So feel free, Becky, to insert anything at any time. So go ahead, John.
Sure. I'm happy to answer any questions. We received, I believe, Becky, notice of proposal or to submit a proposal. We did. We looked at this. I mean, we're really a mission-driven assessment organization that could do a stand-up job for your county in this particular area. We've done assessments all over the United States involving human services, public health, Medicaid, looking at other funding sources for state, usually for state governments. We are currently working in Crittenden County with one of the CDC social determinants of health accelerated grants. We helped them write their RFP to CDC that they just were one of 10 communities that won. And Polk County, by the way, in Iowa is another one. So we have helped county governments with public health. I used to be a secretary of HHS in a state similar size of Iowa and oversaw public health, behavioral health, development disabilities, Medicaid. And back in 2003 to 7, Richard Kellogg, who's on the line, will be doing this project with us, assessment. And Richard was my behavioral health expert at the time and oversaw all Medicaid operations, was a former commissioner in Virginia, Tennessee, and also Washington State. So we bring some national perspective to this project. We feel great about the potential here. I also have a very good relationship with your secretary at HHS, Kelly Garcia, who's a great person and doing a great job for Iowa. And I would be making sure that we are aligned with or thinking or reviewing what is going on at the state level, because they are currently looking at a assessment of their integration of public health into their human services and Medicaid as well. So, I mean, I can answer any questions on our background experience. We've been doing consulting for the last 10 years. I've owned my own company for 10 years. We have about 15 consultants. We're going to assign 3 to this project, myself, Donna Morstead from Texas, and Richard Kellogg, who's on the line from Washington. We'll bring in other resources if we feel we need to. But we think we can do a stand-up job for you in looking at an assessment and also a community needs assessment, which is very important. But that's the second phase of the project. The first phase is really to go in, and the way I understand this, talking to Becky, is assess the current operations of 3 of your units and look at funding, operations, as well as alignment of any potential funding sources that you may not be taking advantage of, or some that are out there that are currently being used that might not be being used to the most maximum extent, and also to ensure taxpayers. That's very important to us in any project we do, that the taxpayers of a state or county receive value from their government services. I remember running an operation, and I had over 3,000 employees and I was also Assistant Attorney General, and I was the Deputy Director of Department of Safety, oversaw state police, motor vehicles. And I always tell people that the taxpayers pay their salaries and that they should make sure in anything they do that they bring value to the taxpayer. So we would look at this whole project in that vein and be happy to answer any questions.
Any questions?
Is it possible for, as a member of the public to ask if it's okay if you say no?
Sure, I don't know why not.
John, is that?
Yeah.
Hey, John, this is Kyle Ubling, I'm a member of the public here. How did you hear about the proposal? Like, how did you get involved with Carroll County?
We just were mailed a proposal form, a standard letter. Didn't know anything about Carroll County. We went online and looked at some of your demographics like we normally would do. And Kyle, we basically are very mission driven to an organization. And like I said, we just helped Crittenden County, one of the lowest income areas in the United States in the Delta region, looking at health equity, social and issues there are very, very important to the community to make sure that there's good county services. And we felt that by looking at this, that we were interested in Iowa anyways. We did work in the last 3 years in Nebraska. We've been in Omaha, we've worked in Lincoln, we were out throughout Nebraska. And I know that Secretary Garcia has taken over and interested in looking at, any help we could bring to Iowa as well.
So just to answer your question too, Kyle, Courtney sent out RFPs to 7 different, I think it was 7 different, yeah.
And how are those, like, I'm guessing there's 50 companies that do something similar as far as healthcare consulting and
Yeah, so I reached out to Chad Jensen, who is on the committee to help guide the review of the state in the merging of IDPH and DHS. So he was on that committee to find somebody. These were the 7 or 8. Chad just sent me those. I sent those out. So this is the same group. These are the same groups that the state used. So we only got one. John, would you like to comment on that a little bit? About, I had
Sure.
told you that you were the only one, and your response was?
I felt like, first of all, I don't know why others didn't bid. I mean, this is just, I can't answer that. I don't know. But I can tell you that knowing the budget that you had for these services, this is a very involved assessment. There's, this is not one where a company like mine is going to make much off of in terms of revenue for our company. It's important for us to do this. We feel strong about it. Our rates have been discounted for this project when you look at the market that does this type of work. But I think it's important, and Richard will tell you as well, that, we want to be able to help a community really improve efficiency and have it's stuff that we have a track record of helping out communities as well. But our rates were substantially discounted for this bid.
Any other questions?
Are we not required to do an assessment like every 3 or 4 years?
Well, yeah, the community needs assessment. Can you, sir, you can probably comment on that.
Yes, hi. So with public health, it's every 5 years that we do the community health needs assessment. And with hospitals, so St. Anthony and Manning Regional Healthcare Center, they have to do it every 3 years to meet their guidelines through the IRS. And because we are contracted with St. Anthony, we usually, St. Anthony provides the community health assessment, and also Manning, they do their own also every 3 years. So that's when public health turns in their assessment for the China hip is every 3 years to stay just with St. Anthony since we're contracted with them.
So
So,
what we're saying is, if it was separate from if it was just separate, Carroll County needs to do one a minimum of every 5 years. Currently, they've been doing one every 3 years because the 2 hospitals in the county have been doing it every 3 years and incorporating the counties.
They're
into it.
required 3, we're required 5.
Right.
So then my next question is, and somebody needs to help me here a little bit. What's the difference between your assessment and what assessment we're getting before?
yeah,
What's the
Becky,
difference?
Becky or John or Richard, I know Becky understands that very well too, but go ahead.
Sorry, I don't have the video this morning. But basically a public health needs assessment is a little bit different from a healthcare needs assessment, where you want to look a little bit more deeply into social determinants of health, some factors that might not necessarily be thought about for your physical health. So, for example, sometimes if it's just a healthcare needs assessment, you might ask questions about, diabetes in your family, or are you currently pre-diabetic, or how many times have you been to the physician? What do you see as the biggest healthcare issues affecting the community? So some questions like that. Whereas really for a true public health needs assessment, you're going to dig a little bit more into county and state and national data. Right now, especially public health, where it's COVID has really pushed the narrative for a redesign of public health infrastructure and services. And so right now is really a vital time to kind of dip into to see what nationally the narrative is really going into: access, equality, making sure that anyone that poverty or transportation or just other issues aren't a deterrent to accessing the care or the services, the social services that people need. So that's why right now there really is a strong focus on the needs assessment, because there is a feeling that nationally funding streams are going to open up potentially a little bit more for public health programs.
John, you
Can I add to that, Dean? I just, from the response or the written, I thought you guys, whoever wrote the RFP request letter, was really headed in the right direction, especially with these times. When I saw that the response, it was well beyond a needs assessment. This was an operational assessment. This was looking at the service delivery. This was looking at the organizational structures. This was looking at cost structures. This was trying to identify maximization of any public funding, especially in light of COVID. These are areas that are deep and involve a lot more than a needs assessment. And I would say about 75% out of the entire project is on areas outside of needs assessment. That's the way we envisioned it from the beginning, which would be very helpful to any county to know what is going on right now. For example, the grant that I talked about with CDC at Crittenden County, that Polk County did submit an application for, that we helped one county write and win. Those areas of funding needs are important for you to all to know real time. Where are the opportunities for Carroll County, for example, not just to align with what the state is currently looking at, but what are the federal opportunities? What are some of the other counties of your size out there doing with social determinants of health? What are they doing in terms of e-referrals, connecting the community to services, not just to 211, for example, which you have great 211 at Midlands, but what are they doing to actually assess, to make sure they close the loop of those referrals, to identify those health needs, but then to get someone the actual help that they need, and then track those outcomes. Because let's say you want to file for a grant in the future, the big grant for your county, they're going to ask you what are not just outputs, what are the outcomes? And those are areas that we would be looking at to help you kind of frame for the future. So it's almost like a roadmap. It's much different than a needs assessment.
Go ahead.
So currently in Iowa, not nationally, but in Iowa, we have plenty of counties that integrate their public health nursing or some form of their county or their Carroll public health with the large hospital in the area, Story County, Mary Bearley, et cetera. I'm sure you guys would know, but wouldn't those counties also typically incorporate their community health needs assessment with the one that the hospital's already paying for? I mean, it's typically 40.
I wouldn't know, and I don't know if Becky would know. I don't, did you hear that,
That might be
Becky?
pertinent for other Iowa counties.
Yeah, I guess I don't know the answer to that right now. And I guess right now we're just talking about what we're doing in Carroll County.
That's what my question would be, is that I think that would be equally as pertinent than what possibly federal funding would be down the lines. What our current Iowa counties doing.
Sure, and John would look into that, I'm sure, because he talked about working with Kelly Garcia and those.
Well, part of our RFP response is to have a team from our unit working with Kelly. We'll contact her, we'll identify who's doing their own assessment. We'll get a key contact that we could work with, we'll interview, and we'll identify a number of things that I think will be very beneficial to you, I hope. And I know that she's doing a super job, but it's really important to know, for example, how the drawdown of federal funds, the McVie dollars, the public health dollars, the Ryan White dollars. I mean, there's so many avenues of funding that come to the communities. Where are they all going? How are they aligning with your operations? And our client is Carroll County. If we were to get this project, what is benefiting Carroll County in the future, today and in the future, would be what we would be looking at.
Well, and I think we keep talking about public health, but also part of this needs assessment is also all of our public health services, which is the environmental health and our home aid care nurses and all that. Correct?
That I'm referring to the global, correct, sir?
I mean, on Carroll County, we're talking all of our services.
Yep. Correct.
Which have been done, so.
This would include, services that actually New Opportunities is involved with as well.
I have a question and kind of a comment. We currently are going through a change in our mental health that we thought that the county or counties or regions were going to be in charge. And then the state has come in and made significant changes to that. I don't believe the services will change, the funding will be changing, and I fear some of the services could change. My question is, why would we want to go down this path right now when we very well could be looking at a statewide change in the very near future that would throw all this away?
Is that directed at Me?
But
So-
one swing at it.
Well, I guess my comment is that you're talking just strictly mental health.
Well,
When we're talking
I
the whole.
understand that,
I don't think the state's gonna really, you have any comments on the direction that you feel, John, that IDP and DHS is going to go?
I mean, that's a really good question that was asked. And look, governments, there's so much change no matter what, that you always have to be ready and willing to know. The governments that, in my experience, can know more information, get more intelligence about what the thought process is going forward in terms of rules, regulations, things that could be changing, and are able to respond quickly, are the ones that are successful. And so we would be looking at that. And what a really good question, because I thought of this early on, that there's some mental health issues that are going to be really important for the county to know today, to prepare for. Richard Kellogg, who's on the line, I'm going to ask Richard to speak if I can real briefly. But Richard is an expert in all levels of government on behavioral health and mental health rules and regulations. Richard would be looking at, what is the state doing? What are they planning to do? How is that going to impact the county today? And how will it impact in the future? And that's important. Richard, do you want to just answer that real briefly? I mean,
Yeah,
first
well,
of all, that was a great question.
It is a great question. And I would just say simply that states have several options that they look at changing their behavioral health systems from county-based. I used to be commissioner in Virginia. It was totally county-based. Now the managed care organizations are the recipients of the money. They take 15% off the top that was going to the community mental health centers. And that's just an example of what I think local government needs to be informed of and knowledgeable about. Try to have some impact before the state makes decisions, and then respond after the state makes decisions in order to protect the service that you have and to continue to try to improve them. And most importantly, if the state moves everything to managed care, that the local government has a seat at the table with managed care.
Well, managed care has really been an issue here in the state of Iowa with the hospitals.
We did that, Richard, a few years ago.
Yeah, and so, it's a big issue. I asked our mental health region CEO here, she was at our last meeting, about how she's dealing with the MCOs, and she said, not very good. I mean, nobody's dealing with those very well. So
Can I add to that? We were down in West Virginia on a project which managed care was there. The county public health in West Virginia, every county has a public health department. And they were having so many troubles with the managed care entities. We came in and tried to help them to identify how to do the credentialing process, how to make sure that they meet certain of the MCO's requirements. Then we would bring the state in and say, these are areas the MCOs are not helping the counties with. Because at the end of the day, there could be billing services that you're losing and dollars you're losing on the table because you're not following proper credentialing. There's all kinds of issues that are important to know that managed care system as well. I oversaw managed care system, and it's really difficult. You need to know those rules, but it's much more difficult for the counties. And we've been in the trenches working with counties, like in West Virginia, the most rural communities, and $15 for immunizations per shot, or whatever it was that they were losing because they weren't credentialed. We're able to help them to identify some of the most basic things that they need to do, because people forget public health is local, and these managed care companies sometimes forget that.
On that point though.
Sure.
Is there anything stopping the county from just asking these questions locally without this kind of expense to say, what are the counties in Iowa doing?
Well,
And they have similar structures.
the thing about, I think with John, and we had this discussion with him too, was, we can ask the question and they can come with the answer and we accept the answer. Where I think when you have somebody who as professional as John, he's going to say, that's not the right answer that I'm looking for. And he'll say, okay, he'll ask that second and maybe a third question. I think that's where locally, we just don't have the expertise to do that. He's been digging. he's been digging into this for years. That's his job. You know, I don't know. Does that kind of encapsulate that a little bit,
I mean,
John?
I agree. I just think you had a lot of foresight to do this type of review now during these times, especially with COVID. And I wish more counties would think like that. But at the end of the day, you know, we're going to do a good job for you. And no matter what, we're going to help you think out of the box, identify areas maybe you're not thinking of today, but we're also going to make sure that what's working, that we'll tell you, our team will tell you, we think this is a good idea. And so we're not going to second guess a local community. That's the number one issue. The issues are all local. What did we hear from what we saw? And then here's just some ideas of what's going on in another state. And I think I said to Becky before, and this is really important. We're not going to tell in our report, we're not going to say you need to do X, Y, and Z. We're going to give you ideas for you to consider to make decisions at the local level for what's best for your county. It's as simple as that. We've done many of these assessments and always very successful outcomes.
Any other questions? Any comments from the board?
I mean, the funds are available. And it was 27 years ago we signed the contract, and it's more than just public health nursing. I mean, it's environmental health and safety. I think obviously he's an expert in best practices from other counties, and then the maximization of the available funds. I don't know that we're utilizing that.
Any other comments?
Well, I get that part, Scott, and I do appreciate that, but I guess I'm kind of tied in a problem here with, as long as I've been on, and I've only been on 5 years, I have not had a problem with any constituent with environmental health, or home health care. I've never had a problem there. They're being run good. We've got good people there. And it seems to me like we're looking for a problem that doesn't exist. And that's what bothers me. Because I think, this is strictly my opinion, that we're going to wind up with another layer of government. And I think that St. Anthony's has done a good job. We found out through COVID, there's a couple of instances that we may think that some things have been done incorrectly or wrong. But I think those things can be ironed out. I don't think those are a big enough issue to make the jump. That's where I'm coming from. I'm scared that 35 or 40,000 that we do spend could escalate into 80 or 90 or more on the other side of the coin.
But it's not just about St. Anthony. I mean, this is about the whole umbrella.
Yes.
St. Anthony's a piece.
Just
under the
a
umbrella.
small piece of it. I get that part. But like I said, as I look at environmental health, I've never had any issues with the constituents not getting what they need or home health care. And then I look at the other part of this, I'm looking at what all this, the effort and things we've put in mental health. And basically that's going to be thrown away.
I see that.
And it's just, that's hard for me to sit there and watch that when I think we're making some headway. But like I said, I'm just one piece of the pie. Those are just some of my concerns, but I think the extra finding the funding, maybe we're not.
I think there
turning
might be
over. Maybe we're not turning over every rock we should turn over.
But I think there might be some missed opportunities of things we're not offering that are available.
We found that out through our ambulance program. We thought we were
Yes.
turning over the rocks that we were, and we found out that there was more there.
With the same kind of a company.
With
making-
same concept.
Yes.
Exact same concept. And that's why I say I see that working there, to our advantage.
And I think it's comparing us to other counties, similar size, the best practices that are out there that we may not be utilizing. I don't think it's necessarily just St. Anthony's. or
No, no, no,
public
no.
health nurse, but
No, I'm not trying to point any
but I was
fingers here.
comparing some other similar sized counties and yeah, it seems to me like there's more available that we're not doing.
And it's really hard too, to the big scope of things, 99 counties. Every 99 county does it different. Because I've got right here, whether you bring it in-house or out-of-house, I'm not for bigger government. But I have Greene County's budget, I have Marion County's budget, you know, everybody does it different. Just these two in general, it is different. So it's really hard to say, well, hey, let's do it like they do. And we do appreciate their relationship we have with St. Anthony's and with, you know.
Maybe we're
Manning
perfect
and-
and don't know it. I doubt that.
But then, you know, to your comparison, I guess. I can also say the same thing about mental health. Why are you guys still getting together? Because you know that's just gonna be stripped right away from us.
I know.
And that's a tough feeling
And that-
because you have worked really hard.
And that's something that's coming up and down in the committee reports. We're gonna have to change the 2080 in a different with the Iowa workforce. Because we can't get enough supervisors to even attend the meetings. Because their hands are absolutely locked. That's what's gonna happen in the long. And I hopefully the state gets their fingers in there before that happens, because we'll be at a standstill. We can't even open a new core service without having enough people there to make those decisions. So that's what's scaring me in this whole situation, is I go down this path and then, boom, that path was just ruined.
You know,
But I don't know that. No
You know,
one's
we have,
gonna-
the thing about it is, I think, is we have a third party here that's gonna look at what's going on and make recommendations, not going to tell you what you need to do. I mean, John made the
Yeah,
comment
yeah.
that everything might be just great, just the way they are.
Okay.
You know, but I just think, it's 27 years, it's been a long time. I think we just need a review so that we can go forward and make sure that we're delivering the service, the health and healthcare services to the county that is expected. You know, I mean, I agree with you. I don't get much comments, constituent comments about public health in the county, but they don't know any different. Can we offer
And
more?
that, you
You
gotta
know.
factor that into, I agree with you on that.
Yeah.
That's a factor you got.
We have CARES funding available, correct? Courtney?
Yes.
I think it's been, I look at it as that we have not done an evaluation in 27 years. And I think that needs to be done, whether we're doing it right or wrong. I mean, I'm sure there's always some improvements. I do think we probably owe it to our constituents that would do the evaluation. I'm a little disappointed in the price tag. And even though the money's available, I don't like spending that kind of money when we're only spending so much in the program to start with. But, and as he said, we're going to come back with recommendations. It's still going to be up to your locally what we decide to do at this point. If we think what we're doing is correct, that's what we'll do. So I don't think it's ever bad to take a look at
Outside eyes are
outside
good.
eyes. I am disappointed in what it's going to cost us to do that. But if you look at over 27 years,
That's pretty-
27 years,
That's pretty cheap.
it probably averages out pretty cheap.
And it's
And the
tough
only- and the
too,
only
because I
reason
don't
I'm
want
not-
people to have hurt feelings over this by us
Oh,
trying to do what's better. We have to leave the feelings out of it and make a business decision. It's tough, and nobody could have predicted what COVID, I mean, that kind of just,
The only thing is, I want to look at the other entities besides.
there's
our
certain things I
regular
would
public
love,
health.
certain ideas I
I'm not so
love.
sure there's
Get rid
some
of that name.
efficiencies we could do there.
They're not sure what.
I'm not so sure there isn't some efficiencies we could do there.
Prime example, look at our VA system we have now. The amount that has, we finally looked at it,
And I
and it's
have
like, what can we do better?
Black over that too.
Yeah, local VA system,
Mhm.
yeah, locally. How we've improved that just by
Outreach,
Well, Becky, you've been
Just
awful
bad.
quiet up there. What do you got?
hiring another individual.
yeah, and the outreach that she's doing.
Sure. Becky?
Yeah, no, I guess just the only thing that I can add is assessment is really one of the primary functions, ongoing assessment of public health, nationally, statewide, locally. This is, I think sometimes what I'm still hearing is that when someone throws out the word assessment or review, that they're automatically assuming that you're mad about something or want to uncover something or suspect something. And that's not what an assessment is. That's not the primary function. It is so that you can learn more, have data, really look at the operations as a whole. So again, this is something that we've talked about on the Board of Health for quite some time. Always just kind of put it aside because, you know, there's always a price tag involved, and public health budgets have been cut and cut and cut for, you know, 15 years straight. So again, you know, this is just to have increased data transparency, looking at increased efficiencies. But again, that, you know, assessment, I don't think should ever be looked at as a negative word. It's positive. And think about, do you go, have any other departments gone 27 years without a review? You know, yearly you have employee reviews every year. Do you look at that as what you're going to point out that an employee has done bad? No, you know, you don't learn and grow and get better without a regular assessment. So.
John had to leave. He had another call at 11 Eastern time. But Richard's still on here. If we have any questions of him, you know, a comment that I'm just going to make is that this was a unanimous decision by the Board of Health to go forward with an assessment, and so they recommend that we do this, and I'm just going to leave it at that.
Did you guys vote on it?
Mm-hmm. Yeah, before we came to the board.
Is that a motion then?
I can make that motion to accept the RFP proposal from the Stevens Group to do a county-wide assessment / review of Carroll County Health.
The motion, is there a second to that?
I'll second.
Been moved and seconded. Any further discussion? If not, all those in favor?
I do have one question.
Okay.
What funding source did you say you were
CARES.
pulling that out of? The original CARES or the second?
The CARES, I think for future, let's call the CARES money the first money we got,
First money?
and
Okay.
recovery funds, second money we got.
Because it is confusing.
Yes,
'Cause they're different.
absolutely. There's CARES money left over from prior that I think would be a good use for that, in my opinion. But
Any other questions? If not, all those in favor signify by saying aye.
Aye.
Contrary?
Nay.
Nay. Motion carried. All right.
Thanks, Becky. Richard, I'll be getting a hold of John.
Okay, thank you, sir.
Yep, thank you.
I just wish there'd been more.
I look forward to meeting you all. I hope I can get a ride on a John Deere tractor.
There's that experience.
I'll see if I can get to 60 here, and once you run a hand clutch. See how that goes.
Make your trip early and you can go combine.
We get you out in the
That's what I
open.
want. Look forward to meeting you all. Thank you.
here by the end of the week.
Oh, thank you. Okay, just do one. All right, guys, thanks for letting me have a couple minutes. Dean, this is a completely updated proposal since I saw you guys a week and a half ago because the state's changed. So what you're seeing here is the original proposal that I brought to the Carroll County Board of Health about a week and a half ago. And then I'll point out the amendments that have changed since Dean gave the report last week. So the identified need on why we came to the Board of Health and through the Board of Supervisors was during this current Delta variant surge, the primary care clinics of Manning, Carroll, and in the surrounding communities have seen a dramatic influx of patients who just need testing amongst other things. They're still seeing the regular heart patients, their pediatric patients. But with a lot more people getting sick, a lot more people getting exposed, there's been a lot more need for testing, which is taking up clinic appointments, making it more difficult to actually see the patients. So with the other thought that Manning brought to us is that there is a proposal to, within the next month, implement a vaccine mandate for organizations, non-healthcare organizations of greater than 100 employees, which will also increase the need for testing in Carroll County because of our large employers that we have. That's still unsettled, but again, that's a possibility of another increase in demand in the near future. So what we have right now, this is on the bottom of page 1. We have the rapid antigen cards in most of the clinics, and those supplies have been steady, not overwhelming, but steady. They are only indicated for symptomatic people within 7 days of their onset. So there's a limited utility to them. You can't just come in as far as an employee and get them. You can't get them because you think you got exposed. You can only use those for people who are symptomatic within 7 days of their onset of symptoms. If we go down to page 2 on the backside. There's PCR testing available at both Manning and St. Anthony. This is in-house. This means you go to one of those 2 facilities, you get your nose poked, and within an hour or so, you get the results. Those supplies have been in dire straits at both facilities, where we've really had to ration them mainly for inpatient use, people who get admitted to the hospital, who have surgeries, things like that. Test Iowa, now this is in italics on the top of page 2. Prior to last week, Test Iowa had devolved from the mass drive-up sites throughout the state, of which Carroll was one of them, into at-home saliva kits. What I presented to Dean and the Board of Health a week and a half ago was that those have to be picked up from Carroll County Public Health or can be mailed to somebody, but then it has to be UPS back to the state. And the turnaround time was around 7 days, which is very little utility when you're actually trying to keep a business open, when you're trying to keep sick people in. And then finally, there's PCR tests through the state hygienic lab and contracts through private labs. So the state hygienic lab had been doing a consistent 2 to 3 turnaround time once it gets there though. Not every hospital, not every clinic has an agreement to get a daily run to and from the state hygienic lab. St. Anthony's been doing it for this entire pandemic, but like Manning doesn't. So that's not exactly the greatest utility if you have to figure out how you're physically going to get the test to Des Moines or Coralville. All right, so I'm moving down to the bottom of page 2. So the stakeholders that brought this to my attention, initially it was in the second block, it was McFarland Carroll, John Evans, Greg Perkins, and Mike Slattery, the senior leadership team of the local Carroll clinic. Lynn Block, the CEO, and Duncan Claus, the CMO of Manning, within a day, also brought the same issue. And then finally, myself and Ed at the hospital. So this is not a single entity. This is truly all of the healthcare providers in Carroll County that are experiencing the same thing. So if we flip now to page 3, now this is what's completely new, Dean, compared to what I presented last time. What I had presented last time was to try to recreate the drive-up mass testing at Manning and in Carroll like we had with the statewide Test Iowa. That would require staffing. That requires somebody who knows how to poke a Q-tip swab the right distance back into your nose to get the sample without hurting you. That actually requires investment of PPE, of FTEs of people doing it. The state has changed Test Iowa, and they announced this about last Wednesday. They've dramatically increased their inventory of the test kits, and Sarah's got a test kit to show you guys. So we have, compared to, they announced the change on Wednesday, we now have several hundred kits available in Carroll County that have already been distributed to every single primary care clinic, Manning, Coon Rapids, Breda, both the St. Anthony and the Manning Hospital, and then the multiple sites in Carroll. So what people have to do now with this new Test Iowa is they obtain a test kit at any one of these Carroll County centers. They provide saliva into the tube that's in the kit. Just like when we had the drive-through testing with Test Iowa, where they go online, they sign up, they get a QR code that they bring, to the test site. That does not change at all, except now they log in online, whatever test kit they got, serial number 123AB. So then that ties this saliva kit to this person. This takes out all of the people process, all of the extra PPE, FTEs, because they're doing it themselves. They're putting it back into the kit. They're putting it into a secure drop box at St. Anthony's ER, which is open 24 hours. 5 days a week, there's a 1-day courier that'll take all of those kits to the state hygienic lab. What the governor also announces with increased ramp up of FTEs at the state hygienic lab, they're hoping for 1 to 2 day turnaround. So Monday through Friday, we'll be able to provide 1-day transport of all the completed kits to the state hygienic lab, and then hopefully they'll be able to run them within 1 to 2 days. So McFarland said that they want to drop them off. They do not necessarily want completed kits coming to them. Manning does. So we're also going to have a Monday through Friday daily courier that will go from Carroll to Manning, pick up the completed kits that people dropped off in Manning, bring them back so that the state hygienic lab courier takes all of the completed kits that were done in the previous 24 hours. So that takes us all the way through page 3. So then page 4 is the cross outs. So there isn't a need for extra FTEs. There isn't a need for extra PPE because now, honestly, the patients are doing this on their own. It does not require a healthcare provider to administer the test to them. And we've already had the relationship with the state hygienic lab to get the couriers. We've been running labs for Manning from long before I've been a physician. So we have a courier going 5 days a week for Manning anyway. So the proposal that being presented last week, which is what I presented to him the week before, is been updated, and we don't need any allocation for this purpose. I mean, this should be able to be done without any extra expense to Carroll County.
The state enhanced it by providing the courier.
No, so that we already had by dramatically giving us the test kits.
Okay.
So doing 5 a day doesn't help, you know, the whole county, and then the turnaround time by ramping up so that if we drop off a test in Coralville, that we don't get the results in 6 days. So one thing I didn't mention. So let's say I mentioned from Monday through Friday like 5 times. Let's say it's a Saturday or Sunday. All of those kits have these included paid UPS postage. So if somebody on a Saturday wants to drop it into a UPS drop box, they can. Otherwise, they can drop it into the drop off at St. Anthony, and it will be picked up on Monday. But so the press release that goes out this morning will say, if it's on a Saturday or Sunday, consider using the postage paid UPS slip in there. Otherwise, Monday through Friday, your quickest results are likely from dropping it off locally.
I don't trust the postal.
Well, it's UPS, not USPS.
Yeah. So what kind of turnaround are you gonna get from UPS though?
But that's the thing, and I mean,
Yeah.
I don't know a lot of things, but I know the things I can't control.
Going into their week on Monday to.
So, but anyway, but the courier is 5 days a week. So, but this is, I mean, literally, Sarah was able to order and receive in a couple days hundreds of test kits. So what I presented to Dean was that we were hoping to be able to do 60 a day repeatedly in the county. We can do far more than that with this without having to ask the taxpayers for any more money.
So 3,000
ready to available from this point.
As of this morning, they are at every single primary care location and Carroll County Public Health.
Are you gonna be able to get your supplies?
We can order 250 test kits a day.
for the whole county, and then you distribute them.
Yep, absolutely.
And then on that note, the Carroll Clinic is looking at possibly signing up to be able to receive them on their own without having to go through it, which is great. I mean, if they want to, man, can do the same thing if they want to. Otherwise, we'll just keep ordering and making sure that we're able to distribute them. So, I mean, before we were talking this morning, all those clinics have them at their site. So the press release goes out this morning.
Sarah, can you kind of give us an update on COVID, Carroll County?
The 14-day positivity rate right now is at 12.7.
Is that what?
12.7%. That is down from 15% last week, which is great. We still do have positive tests coming in. Number of touch points this morning. But, we're still having positives, and people are still testing. The need is out there for sure to be tested. I get texts and emails, hey, I've been exposed, what do I do? So the need is definitely there.
We're still housing patients from out of county. I mean, when I say out of county, not even like a neighboring county, but from anywhere in the state, because of, on average, there's 3 to 4 ICU beds in the entire state open daily.
And that's it? Really? That's disturbing.
So actually, this here would be a better option than home kits, isn't it?
So yes and no. The nice thing is, I made the analogy at the Board of Health of the pregnancy test. It'd be great if you could have this test with immediate results at home, right? I mean, because this is still, we're talking about 1 to 2 day turnaround time. That's what it would be if we had the rapid PCR tests where you could have the own result in your house in an hour. And Dr. Hine from the Board of Health mentioned that too, and I completely agree. When those get offered, we'll pursue.
But there is rapid tests, or those, is it the Abbott test, that's a rapid?
So those are one of those in-hospital 1 hour turnaround times.
Right.
Yep.
So why aren't we using those?
We are, as soon as we can sell the reorders.
Okay.
It's one of those things where you place an order and your order is confirmed and you never get the shipping notice.
Okay.
Because they're allocated.
So,
Yeah, we've got one.
is there a lot of people buying these other home kits? Are they reliable?
So the one thing you get your results like the pregnancy test yourself, those are antigen, which are not PCR. They're less sensitive and less specific. They're not horrible by any means. At the beginning on that first or second page where I mentioned the ones where you're only supposed to use them if you've been symptomatic for 7 days. Within 7 days. They're much less reliable if you're outside that window. If you're asymptomatic, the false positive rate is higher than what we'd like. And if you were symptomatic 10 days ago, the false negative rate is less than what we'd like, but they are not horrible.
Test kits for people that have had COVID, they have a certain window that they are okay. Are those readily available?
So do you mean like the antibody tests?
Yeah.
So not for home use readily available, but easily available at any hospital lab.
And they're be accurate?
Yeah.
So what is that window? Have you heard?
So that's the whole
That
kit and caboodle.
question?
No, that's the whole kit and caboodle of natural immunity, is that you and I can get exposed at the same meeting together. In other words, we both get inoculated and contracted at the same time. And because of health issues or whatever, you might have robust immunity for 3 months, 4 months. I might have it for 2.
It isn't the same.
It's just not uniform. Likewise, I could have it 7 months later. I could still show high antibody levels and yours could decrease after 5. So there's not a lot of rhyme and reason. There's several studies that have been out, but they all use different endpoints. They don't all use the exact same. What do we mean is good? What do we mean is yellow? What do we mean is red? But yes, for antibody tests readily available at any hospital.
And it appears to me that they're using those, some doctors are using those as well as to determine whether or not you had COVID.
Correct.
So if, an example that I heard was where the person felt he had COVID and he called his doctor and he says, well, stay home. There's no need to come in, but in a week or 10 days, when you feel better, come in and we'll do an antibody test to see whether you have.
And that's reasonable. In other words, you're outside of the window for doing the test to detect the virus. In other words, there's no good indication to do a regular test at that point. So then you do an antibody to say, yeah, you probably were exposed at some point. And then when it was, you go by symptoms. Because there's not a timeline to say if your level's this much, if it's a month ago, if it's this much, it was 3, you just say, yep.
But if you're not feeling good, if you feel like your condition is going downhill, be sure to come in.
Stay home and call your doctor. Those are the 2 best things you can do. Stay home and call your doctor, because some of the doctors will arrange for testing without you sitting in the waiting room for 20 minutes.
Right.
So stay home and call your doctor. Not the worst advice actually outside of COVID. If you're sick, stay home, call your doctor and ask what you should do.
So are these tests, usable for the people, the employers that have more than 100 employees?
Great, yep, that's why we're ordering is,
So that people come in and get 10 of them for the next 10 weeks? Is there?
exactly right.
I think it is.
Yep.
Wow.
We just to get them vaccinated.
So best thing, I answered this question this morning for somebody. Right now, Iowa and the United States in general is averaging more people getting their 3rd shot than people getting their 1st. Okay. People getting their 1st shot will help get this over with quicker. People getting their 3rd shot will protect that individual better. So I can tell you, I got a Moderna vaccine. I don't have a 3rd booster shot approved. When it does, I will absolutely get my place in line. But it's more important that people who haven't consider getting their 1st. That will help the community there.
So, Sarah, can you give an update on that, on the vaccine? Are you getting regular giving regular
Yeah,
vaccines?
so currently we're doing about, on average, once a week clinic, for the COVID vaccines. I would have to say last Friday when we did, we gave about 15 Pfizer doses to third dose. And probably 5 to 7 from first dose of one or the other, or the changes. So.
That'd be a good thing that, because this was relatively new information about getting timing, flu shot, COVID shot.
Yeah, you can administer simultaneously. There is no need to wait the 2-week period any longer. Where initially when the vaccines all came out, we asked, that there was a 14-day window between any other vaccine and getting a COVID vaccine. CDC and BCID have included their guidance that you can receive them simultaneously.
Or at any interval.
Or at any interval.
How many doses a week or a month are you guys throwing away that expire?
A week, not many, because it's about a 3-week or 3-month expiration date on most things. But you know, unfortunately, we're coming up on Moderna. We're going to be expiring quite a bit. Maybe it's hard to say. Oh, right now I have about 300 doses in my freezer. November 8th is when they expire. And we actually ordered a bunch. We ordered 1,000 doses. We gave half to McFarland, anticipating the third dose, but the third dose hasn't been approved yet. So
What if somebody comes in and say, I want a Moderna shot?
then we'll do the Moderna shot.
You'll give them
First or third?
no, third.
Oh, third? Oh, third? No, sorry. Sorry, I think it's first. Like, yeah, we'll go ahead and do first. Third, no. We actually just had somebody call in there traveling, and this country is requiring a third of both Pfizer or Moderna. And they're fretting a bit because it's not, I told them, I said, I'm sorry, it's not approved yet. I cannot give it to you.
Just a chance you can jump manufacturer.
So for there's two groups who are indicated to get a third shot right now. The first group approved over a month ago was people who are truly immunocompromised, who are getting active treatment for cancer, have an organ transplant, have condition like rheumatoid arthritis where they're on immunosuppressive medicines, have lung disease and are high doses of prednisone on a regular basis. We're talking about very narrow slice of the population. They can get a third dose of either one. Doesn't matter what they had first. For the general population who are just past 6 months or 8 months from their second shot, Pfizer is the only thing approved right now. I'm across the hall. I get the email saying we have 2 more doses of Moderna left today.
Don't they originally want you to stay?
Yeah, you might qualify.
If possible.
President for an iPhone.
I would refer you to your doctor.
Which one?
Whichever one. And honestly though, and I'm going to commend Sarah and Nikki. For every hiccup that happens, if you look at Carroll County compared to, I'm not going to name the other counties in our surrounding areas. Not once did we have a cold, like 90-year-olds in a church parking lot at 7 a.m. only be told that they were out of doses. By them getting it to the original directive from the governor back in December, January was 50% of the vaccine should go for essential workers, 50% should go to the general population. Initially, it was like 75 and above, you know, the age appropriate, disease appropriate. By getting into the clinics, so where people didn't have to prove their conditions, they didn't have to prove their ages, the clinics already knew them, they had all of the information. Carroll County Public Health utilized 110% of their vaccine by getting all the little extra doses out, things like that. For the entire time that we were, you know, on those narrow 200 doses a week kind of allocations from the state, things like that. They did an excellent job of making sure Carroll County used every single vaccine and didn't have those pictures. Dean, you helped in the mass one at the end of March. I remember seeing you outside of the Westgate Mall. Carroll County with them, they did a tremendous job of making us look like we knew what we were doing.
So when you give the first shot now, do you can give either Pfizer or Moderna?
Yeah, for the first one.
For the first one.
Yeah.
So, you know, if a person comes in and says, well, you know, the Moderna is not, you know, approved for the third shot, why would I want to get it? Maybe I want to get Pfizer. So that doesn't help delete your inventory of Moderna. So I mean, is that an issue?
Well, yes, it is, because we have a whole lot of Moderna on hand currently.
Do you get that? Do you get people, so you have both, correct?
Yeah, we actually have all three on hand
Okay.
right now.
So do you get requests for a specific one?
We actually get a lot more requests for Pfizer.
Okay.
And then you just tell them, in case they didn't know about how, like Moderna, Carroll County Public Health, they order those pretty well.
Right. So typically the state will send us, IDPH sends us out an email, an alert saying that we can order any vaccine, which is Pfizer, Moderna, or J&J, every 2 weeks. We usually order the Moderna or the J&J because of the quantities we could do in 100 doses at a time.
Smaller quantities
Right.
appropriate for our.
Got
Or
it.
like Pfizer, you have to order a flat, which is 1,170 doses. That's a ton of doses. We typically split that half with Greene County. So Greene County will order it. We then take half and we usually give half to McFarland right away. And then any other clinic or hospital that would like it, we then reallocate to them. Reallocate.
That makes a lot of sense.
We got a handle on their supply chain, some Moderna, and you're getting close to being expired. Will you just ship yours right to them rather than send it, just let it go?
I sure can, right, yes, because I actually, right. Yeah, I actually just shipped 158 doses to Story County of my Pfizer. That it was nearing expiration, they had big plans, so.
Now, just to clarify, you're saying that you're splitting with the farm. I assume you're also given an allocation man.
Yep, absolutely, whatever they want, we get to, yep. So McFarland is just one of the bigger ones that they're always wanting as much as they can. We're meeting, the hospital there will let us know if we need a vial of J&J or if we have 12 doses of Pfizer. And we just get it sent to them.
Sarah and Bailey work with Jill Art, the infection preventionist at Manning, we've been coordinating their vaccination program. And I go to Manning twice a month, and I talk with Lynn Watts, on the exact same issue twice a month, so. The only thing that I told Lynn is with the Pfizer being, with us, that being a little, don't ask for 1 day turnaround on getting the Pfizer doses, give us a couple days of lead time to work with another county to get. Yep.
Thanks, great.
No, thank you guys.
Very good.
And ladies,
Thank you.
Thank you.
Good news. Thank you.
Okay, Zach, you got any interesting?
Yeah.
If I would say interesting.
6,000 you can leave.
Yep, you filled a couple of jobs. That too. I do have quite a few utility permits. It seems like they come in flushes, but first one is for Windstream, and this is for relocating a copper line. This would be Jasper section 27 on Velvet Avenue. This is the location where we have our small box culvert that we're putting in. The existing line is in the way for that. So Windstream is going to temporarily relocate it, and this permit is to put it in permanent after they get the box completed. They'll bore it in and put it in out of the way for good. So we'll talk about construction of that box coming up here shortly, but that is happening this week as well. So that's why this is kind of all coming together right now. But so all this is moving that line, boring it in deeper and out of the footprint of that box.
Any questions on that? What we've done in the business?
Probably they're kind of different ones. The next three are all very similar. We could do the next three together if you want.
I'll make a motion to approve the Windstream utility permit.
Been moved and second. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Contrary, motion carried.
Thank you. The next three are for Raccoon Valley Electric. First one is Union Township, section 28. This is for a new house just north of Coon Rapids. There will be about a third of a mile or so of quarter mile of new poles set as well to get to this property on 320th Street. So a little bit of new above ground line, and then a bore underneath the road to get it across to the new house on the north side of the road.
Okay,
And I can keep going for what the other ones if you'd like.
yeah, if you want to do them all, do the next one.
The next one is Pleasant Valley, section 1930. This would be just west of Willie. New house on 260th Street, the north side of the road. No new line work there, just boring underneath the road, getting the power to the north side of the road. Then the third one is Glidden Township, section 24 and 13. This is north of Ralston. This is born underneath 190th Street, getting service, a new electrical service to an existing acreage. All very straightforward, nothing outside the norm of what we normally would have REC do.
So those are all for REC. Is
Those are all three for REC.
there a motion to move those?
So
Second.
Then moved and seconded. Any further discussion? If not, all those in favor, signify by saying aye.
Aye.
Contrary, motion carried.
Thank you. The last utility permit is from Mid-American Energy. This is section 33 of grant. This is beyond N33 of the Denley Road, just south of Carroll. A new house as well there on the east side of the road. This is just, again, a bore underneath the road. The line is existing on the west side, so getting it to the east side of the road. Nothing odd about this meter, another very straightforward bore.
The address is North Grand Road, but it's also on the Olympic Avenue, so
address is Olympic number,
it was that.
the address would be Olympic. not
Okay.
Grant Road would be Mid-American's address.
Yeah, right. It'd be on Olympic Avenue. It's in Grant Township and their facilities on Grant Road.
Yeah, I think I did that when I was looking these up too. I looked at that grant address. And I did have a couple of them. That's the goddamn company.
And I didn't get the township and section written on the Windstream and the Mid-American before I had got them sent.
The map.
Hey, you heard that one? Is there a motion to approve it?
So
I'll second that.
Then moved and second. Any further discussion? If not, all those in favor, signify by saying aye.
Aye.
Contrary, motion carries.
Thank you. Construction update, E46, the Halber Blacktop. The yellow center line paved markings got done last Friday, I believe, and I believe they're working on the white as we speak. We should be down there getting the stop bars done and the edge lines, so hopefully that will wrap up that project if that gets done here this morning. So turned out pretty well, pretty quick turnaround for those 3 miles, and nice to have that one done. Other construction, the box on Velvet Avenue, the 10x5 concrete box. The contractor will be moving in later today or tomorrow to start on that. That should be a pretty quick turnaround. I'm guessing a couple days, 2-3 days, and they'll have that put in and backfilled and get it back opened up again. So it should be a pretty quick process on that box. And we still do have one more coming. Haven't heard from the contractor on that one yet, but I'm assuming it'll be in the coming weeks here. So our crews are working on a 72-inch pipe on Hawthorne Avenue, south of Templeton, just across the north of the Ogden County line. They started on that this morning, taking it's rusted and starting to fail, so we're getting that one replaced, so we'll have that section of Hawthorne closed for a few days as well, getting that
Can
replaced.
you repeat that one more time so I can report that correctly to the speaker?
Replacing a 72-inch CMP braided metal pipe on Hawthorne,
Hawthorne and South of Templeton.
south of Templeton.
Okay.
Yep, it's in the last mile before Ottoman County.
That's a big one.
It is.
Yep.
I see it right the other day when I was driving that way.
Yep.
Yeah.
You said it's gonna be closed for a few days.
A few days. Any questions on construction we have going on?
How you doing on the parking lot?
Not too bad. I think they got 3 pours done so far. They got probably 2 more to do on this side yet. That the big driveway coming up, there's quite a bit there we're gonna do. Trying to sprinkle it in amongst all the other things going on, so.
Looks good. What you got done?
I follow the combine going south towards Dedham,
Did you?
and that 2 foot on each side is just enough.
4 foot.
Well, yeah, just enough. They're still close,
Yep, it is.
but at least they don't hug the center line
Right.
quite as bad.
And-
A little less dangerous.
I like how the shoulder outside of that turned out. There's not a lot there, but there is a little bit there of slope, I should say, that's correctable. So definitely a definite improvement for what we had, for the right over we had, and
I have heard a lot of compliments on that, so.
Yeah, I was down in Mills County here on their county roads. And one of their supervisors was in the bus with us. And I said, "Where's the shoulders here, Richard?" And he goes, "Can't afford those." And then I said, "Well, where are the lines, the painted lines? We can't afford those either." I mean, they have no shoulders.
Mills?
Yeah. Fremont's the same way. They have no shoulders, they have no painted lines.
yeah,
So
it's-
we do a real good job here. We take care of.
Well, on a lot of your newer vehicles, you utilize those lines.
Yeah.
And also, then also integrate the speed signs.
Mhm.
Into when you get to a certain spot, it shows right away the speed limit. Except for some roads. it's maybe one way.
Google's not caught up on speed limits yet.
Mhm.
All speed limits.
Department update, we did get 2 new employees hired. We did get a new mechanic, Jarrett Bach. He started this morning. As well as a new equipment operator, Todd Tigas. He started this morning as well, so good to get back to full staff and get them acclimated and keep going down the path, kind of get hopefully some time in before snow starts to fly. Hopefully that's a couple months yet.
Anything else?
That's all I have.
Any questions for? Good job.
Thank you.
Snow removal so far.
I like it.
We could probably get through the month of October without a killing frost yet. the way it
It
looks.
sure looks like it.
Jeez, that's pretty crazy.
Those little black bugs.
All those little black bugs.
Yeah, the little black bugs could go away.
I'm enjoying what's left. So.
Yeah.
Okay, next we have is tables. Any questions on the tables?
No questions. I'll make a motion for tables today.
Been moved and second, to approve the payables. Any further discussion? Not all those in favor, so you're probably saying aye.
Aye.
Contrary, motion carried. Next is approve the housing grant, claim number 6. This is for total $32,819. Is there any questions on that? If there's no questions, we need a motion. This is just basically, again, I remind, this is a pass-through grant. Okay.
Region 12, giving Region 12 permission to it. I'll make a motion to approve. Housing grant program claim number 6.
I'll second.
Okay, there's been a motion and a second. Any further discussion? If not, all those in favor signify by saying aye.
I
Contrary, motion carried.
need your signature under the claimant's signature and Louis. And this is so Region 12 can submit their
Upside
claim
down
to the
line,
state to get paid. And then once we approve it, then they send the claimant, and then we get our money, and then we get back to them.
You said where it says claim signature?
Yeah.
The circle, that's.
Yeah.
Which is good that there's that many people liable on.
Absolutely, yeah.
Okay, next we have is the manure management annual update. First, we have Doug and Don and Doug Durkin, farm section 21 in Wheatland Township, no changes. Dale Ludwig, farm section 11 in East Township, they added acres. Kevin Baumhofer, section 10 of Maple River Township, no changes. Shown West Side, section 34, Richmond Township, no changes. Danny Kennebec, section 13 of Roselle Township, no changes. Aurora North Place, section 21 of Richmond Township, no changes. Okay, next we have is committee reports.
I can go first. I don't have a lot. On the 6th, I went to Audubon, snagged a ride, went to Audubon, went to the Western Iowa Advantage in Audubon. Good program. Speaker was from Des Moines County. I did like that he, a lot of the speakers talk about larger communities. He brought it back down to a small level, talked about a tiny community of Morning Sun, which is not even incorporated anymore. But he has watched the progress of it. That was very interesting to watch how that happened. And the other
With 750 people, where he came,
Mount Union.
that's it.
Mount Union and how they swung the other way for them, where they actually did increase and managed to maintain a little bit of their downtown, town of 700, which is very hard to do. But I thought he related it to the smaller communities because you remove Carroll from West and Carroll, Denison, and probably Jefferson from the equation. That's what we all have in our region. So I'm glad they related it to smaller communities. I did appreciate that. On the 7th, I went to the conservation open house. And then I went to Region 12 and I had 3 meetings there. The Policy Council, which was later, the Executive Board, and the Development Corporation part. We had 2 loans. One was withdrawn and the other one was approved. Well, with conditions to be met yet. So we'll find out about those conditions on that, see if that at the next meeting. Other than that, stuff and Scott were at the Policy Council, so I'll let them try to cover some of that. Then on the 8th, on Friday, let's go back to Region 12. He gave us a chart of upcoming possibilities of the way they're going to ask for funding going forward with the new census. They're trying to level out because we have a few communities that's not in our region that belong to our region, but they pay on a per capita basis. So we're trying to make that square with everybody a little bit better. So we have many scenarios to look at. And again, it's to a person that can see very good. So hopefully next week or two, I'll be able to make more sense of that. And on Friday, the WIWD, we had a Zoom meeting that is basically the same problem I alluded to earlier. We're going to have a 28E agreement. It's being constructed right now. It should be out to us soon. I don't like it, but I understand why we have to do it. I would rather we had better participation, but our problem is it takes at least 12 people to move forward. We have openings on our workforce boards. We can't appoint anybody in because we can't get quorums. So what we're going to do is we're going to look at dropping it from 12 to 7, which will be a third plus one. It meets all that. What we did some reviews, and I guess they run it by several county attorneys, and it is legal to do that way. So I think it's the only way we can go right at the particular time. Would I like to have more participation? But again, the programs are pretty much cut and dry. So why would you want to participate? That's the problem we're having. And I think that's what we're headed for, probably in mental health. Hopefully people will keep their constituents in better regards than what this is going on. So that will be coming up soon. I'm probably going to vote in favor of it that day. Like I said, I don't like it, but I think it's the best alternative we can come up with. Other than that, Gene and I had a conversation about a issue from Coon Rapids. We've visited with him about a couple times, he had some questions on contact dates. I gave those to him. One of them was that contacted me 2 days after I had eye surgery, and I talked on the phone, but I couldn't look up much of anything to really help him with, and I told him I would visit with you guys about it, but things have blown up since then, and this is the first time basically I've seen him. So we're going to kind of let that go where we're at. It's already over and done with. I don't see an avenue for us to go backwards. I suppose it's possibly legal, but I see no advantage to it.
And this is in regard to the crew reps where we give the relief to on property taxes, suspended the tax. It was brought up to my attention. They thought we could reverse that decision. So I was contacted by the city police chief down there. And first I was contacted by the paper. He wanted an understanding how the suspension worked, and I went through that. But anyway, they are the underbelief from their attorney that we can reverse our decision. So I asked John about it, and I had a discussion with John. John says, if the conditions have not changed in that individual's requirements, you really shouldn't change it. So I don't feel, but what has happened for the rest of you is that this property, which we were not aware of, they consider derelict property. And the gentleman doesn't have any utilities in the place, and they're not a generator, a garage, or other places. So subsequently, he's had 2 fires in the structure, one in the garage, one on the house. And a lot of other issues. He doesn't have utilities. And so they were planning on utilizing the tax sale to get a hold of this property. We were not aware of that. I guess if they were, like John said, if they were planning on it, they should have probably let us know that so we had an idea too. I think there's, probably it could be some issues on both parts that we didn't know each other's situation. How we rectify that, I don't know. But the thing is, the situation has not changed in our eyes or what our requirements are for that suspension. So John says we should not move any further in our direction. He says they have other avenues they can move down to get control of that property. So if you guys, and I guess at this time you guys do the same way, that's why we're going to drop it. I will let them know that.
If they use other avenues to get a hold of property and then they take ownership of it,
They'll have to.
will they? They're exempt. Do they have to pay, I mean, they wouldn't pay it moving forward, but they have to pay it back.
They'd have to pay back. Just like if you go and buy a piece of property or something, we have to pay that taxes up that point. So those taxes will be due from that.
From the city.
Now,
Or whoever buys it.
I would think that if the city winds up with it and they did approach us, we might be able to forgive those here.
Yeah, I would say let's probably maybe work.
Now, whether we choose to or not, that we'd have to look at the situation at the time. Also, Region 12, I did visit with Chris Whitaker about this, and he has done a lot of dereliction of property in multiple cities, jurisdictions, and he's got a good handle on it, and I'm gonna recommend to them that they visit with him about it. And because he's done a lot of legwork on it, and he can tell you exactly what it is.
Yeah, it appears to me that we should, if we're hearing from anybody, I mean, you mentioned two parties, but don't we need to hear from the city and the city clerk and
Well,
that type of thing? I mean, that's the government down there. That's,
I wish they wouldn't have caught us flat-footed because
And I
we
think
had no idea what was going on.
police chief was the one that was supposed to. do
yeah,
something.
I understand that, but I mean, but he should have went to the mayor and
Reach
made-
out to one of us, anyone.
Yeah,
We're not that hard to
I
get.
got it.
Well, and it's not proper for normal procedure when you guys approve a tax suspension.
And I told
Look
them.
into the history of the house and what kind of house it is.
Most time our direction comes through a DHS.
Yes.
And I told him that this is the only time that we've had someone actually walk in the door, present themselves for that, and I said, when he did that, he basically opened it up to public scrutiny because it was an open meeting.
And he had that, which I assume do the rules very well.
So, I mean, yeah, it's a bad situation. And I could go into more, but.
Yeah, we spend too much time on it already.
Well,
It's just,
you try to quench out the fires.
Yeah.
Yeah, hopefully.
Yeah.
Move forward.
that's all my week.
Got anything coming up?
Let me look quick. Yes, I think Wednesday, I am going to step in for a little meeting with Steph.
The CH Wednesday,
Yeah.
The CH one.
the CH Wednesday morning.
Oh, yeah, I didn't know that. Yes, I'll have that too Wednesday morning. Better add that because I wasn't around during the last meeting. I didn't put it down. Other than that, that's it for me.
I'll go next.
What
okay.
meeting is it first?
It's not really an official meeting.
It's something to the chamber.
Okay. I'll go next to piggyback on his Region 12. Last week with the Conservation Open House. Then we had a Region 12 Policy Council meeting. The only thing that was a little bit of, took some time there. Region 12 currently does not have like a banking system, so you can't bank sick time hours. And that was a long discussion as they should start working on policy to create this bank. So if you have an employee that becomes sick, doesn't have acquired or accumulated sick time or vacation time, you can go in and say, okay, I'm gonna donate 20 hours of my sick time to that person. And there was a long, I think we probably talked about it for an hour. Maybe longer. There was some mixed feelings. I was not in favor of it, not of the idea. It just, the details, there was too many questions to create policy. I had an issue with that. And actually both these guys felt the same way. So we got outvoted, but so going forward, they're gonna try and come up with some new verbiage on how to incorporate a banking system for their employees so they can donate. So let's say Courtney never takes a day off. When she goes to retire, she can donate her sick time, is that correct?
Or a week to
Yeah.
other.
Yearly,
Days of it.
that you don't use and you can't roll it over. we'll kind of keep you guys informed about that too, because there's some verbiage here. But I think pretty much quite a bit of it's gonna be rewritten, and we're gonna take a look at it again in April. That was really the only thing of significance that we're working through, so if you guys want to read about that, you can. And then Dean has already brought this up a while ago with conservation, but we did do a memorandum for just noting that the Iowa Department of Transportation Commission awarded $900,186 COVID trail funding. That's already been mentioned. Really, that was about it. The transit's going well. They are getting a new car at some point, whenever that actually comes in. I think that's really all the highlights. There's one home being scheduled to deliver to one of the prison homes to be delivered to Denison. This next, it was last week, that same night, last Wednesday. And then the only one in the regional orders is in 2022 for more.
I do want to step back.
Yeah, go for it.
Congratulate the conservation board on that. They built. Very, very good idea, very well done. Worked out. It's gonna be nice. It's gonna work great. For a long period of time.
Then I did spend some time working on some of this public health, gathering some more public health information to try to just wrap my head around the whole concept of public health and that whole entity to decide if we should go forward with this assessment. A few emails and a couple phone calls with Gene. This upcoming week, I do have Wesco tonight in the newspaper and radio today. And may or may not be in attendance to the SCH meeting Wednesday, because I do have to attend a funeral. That is it.
Next. Last week I was at the same meeting with Stephanie, Policy Council, Region 12, she covered it pretty good. This week, tomorrow morning, I have a landfill monthly executive board meeting. Wednesday, SCH meeting here at 9 o'clock, that's all I have.
And I can go next. Last week, it just seemed like there were balls in the air all the time. Just one of those weeks. I did have, it seemed like I was on the phone with calls that we had made appointments for. I mean, John Stevens, and then with John Gacy, I did get with him from SEH and had that conversation with him on Tuesday. Then on Wednesday, pertinent, we had the executive committee had for the North Raccoon River Water Management Coalition had a conference call with the DNR on possible. And I think I mentioned a little bit about this last week, probably about how there's some grant dollars available since the coalition did vote to make the recommended nutrient reduction strategy at 48%. That make them eligible for DNR 319 grants. If they would have went with the 41, they would not have been eligible for that. So that seems to be right now, something that we're probably a little bit grateful for. We don't ever plan to ever get to that 48%, but I don't think anybody thought that was going to happen. So we had a discussion with them. They're fairly confident that there should be some dollars available, and they're going to work hard with the coalition to make some of that happen. And then we had on Thursday night had the grand opening of the East Side Shelter House, and that's a really good thing. I think they'll keep that busy. They'll keep that. There'll be people using that. I think they need to look at their rental prices for that. Get them to where it's comparable to other entities that are around here. And then on Friday had the North Raccoon Water Management Authority meeting, quarterly meeting for everyone. We held that locally at the Ed Center at Swan Lake. People were very impressed with the facility. They want to do it again sometime. Jason was very happy that we could host it. We need to get the word out that that's available, you know. The only problem we had with the meeting was, again, we needed 36, there's 36 members. So we obviously needed a quorum and we didn't get it. However, well, with that big a number and, you know, I think we're gonna continue to try to whittle that down and try to move some of these smaller communities who said yes, but never attend, you know, to get them to just back away and not be a member anymore. But we didn't have any action that to be taken, so that was good. I guess the big thing is, and locally, Ethan Thies is with the DNR, and he's actually, he is actually lives in Carroll. So, I mean, he's a good local guy. He's a young guy. He just moved here. But he was in charge of the Blackhawk Watershed Project when it went through. I think they spent, I can get the number right, I think it was close to $3 million, you know, and you're probably a little bit familiar with that. It could be even more than that. Yeah, that could be. I think it was probably $3 million in grant dollars. And then locally, they came up with another $900,000. Yeah, so it was, so, and there's, they got good things going. And the big goal there was for years to reduce the sediment in the lake. And they got some good things going there. It was a good project. And then there was discussion on the annual meeting, which will be in January, January 14th, probably. There are dollars available, grant dollars. I think that one thing that the DNR throughout the state and the EPA, when it came up that the Raccoon River was one of the dirtiest lakes in the nation, is one of the top 10
Lakes or
rivers in the country. That pretty much got some attention of some people with money and the EPA and the DNR. So it sounds like they're going to free some dollars up. So that was my week. This week I have Conservation Board meeting tonight in the courthouse special needs meeting on Wednesday morning. That's it for me.
It's your Friday meeting. Did you decide it's Polk County going to bail out Una Vista for that $6,000?
Oh, yeah, what was, you guys talking about that?
No, I think that, well, there's several schools of thought on that. I passed around, didn't I? You guys saw that. Yeah. So, yeah, I think that, you know, I don't think that Una Vista has any terrible heartburn about that. And I think there was a lot of people who said, well, you know what, you wanted it, you know, you should have been responsible for that. You should have been able to cover those bills when there was dollars available. So I don't think it's going to move forward where anybody else is going to. I think it'll probably just sit there. Yeah, there wasn't really much discussion. I think they're going to try to leave it just the way it is.
Okay, last week I did the paper and radio, and then after the meeting Monday, I went out and signed a bunch of documents about new opportunities. And then I'm supposed to have a CADC meeting on Tuesday, I got canceled. And then Wednesday, I attended the Western Iowa Advantage annual meeting. And I would agree with Rich, this Jason Hutchinson. He did relate it back to smaller communities. And two of the things that he talked about was the housing and the connectivity. And I can't remember the third, the life of me. And, but anyway, it was down to earth more than for us around here, for our area. Then Thursday, I attended the Shelby Open House. And as Dean says, juggled a lot of balls last week. I guess I call them fires. But I had several conversations with Cooper Rabbit. And then I had another issue with another board that I'm on. In regards to employment issues that we were trying to put out. This Wednesday, I have the special needs assessment on Wednesday, and then it's supposed to be a board meeting Friday at the Yes Center, but I got a feeling maybe there's a chance, but maybe a chance, because they kind of suggest that already. And we'll see what else comes up. Where do you get anything?
No.
What we got next week?
Recorder's quarterly report. Some interfund transfers and a survey.
Interfund transfers
Yeah, but-
necessary.
I would think the engineer would think so, yes.
Then we should have.
Yeah, we'll do the interfund for the roads department and also the TIF.
That's just.
Can you get better at doing those on the same day we have in the expense reports? Just asking.
Doing what?
Interfund transfers.
No, so we do all expenses and things like that on the same day. Right, no, it's not possible.
Is there any comments online?
No, I don't see any.
All right,
You're awake.
Yeah, you woke me up. Thanks.
that wasn't good to do.
I'll make a motion to adjourn.
Second.
It's been moved and seconded. Any further discussion? If not, all in favor, signify by saying aye.
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 Contrary, motion carried.
Thanks, Dalton.
Thanks, Dalton.
I'm sick.